Hi, I'm Dr. Devayani Barve. I'm a plastic and cosmetic surgeon and I practice in Mumbai. In this video, I'm going to talk to you about a remedy for fat loss. Now, though that sounds very attractive, it is not exactly that we do it for fat loss or for weight loss. This procedure is basically large volume torso liposuction. It can also be called as mega liposuction. Now, the patients who qualify for this kind of procedure have to be selected very diligently, have to be explained the pros and cons, and also have to understand that there is a recovery period which can vary from 2 to 4 months, which goes along with it. In mega liposuction, we can remove up to 10% of the body fat. So if you weigh about 80 kilos, I can target to remove about 7 to 8 liters of fat. Now this fat, if it's located in 1 or 2 close by areas such as the front of your tummy, the sides, the back, then all of it can be targeted together, and that is called as large volume torso liposuction. Now what all does this surgery entail? You get admitted on the same day in the morning. The surgery is planned for the first half of the day. It typically takes around 4 to 6 hours depending on how much is to be removed. The time of the surgery also involves changing position. That's why it takes so long. What I mean by that is, if we are doing your sides, then we will be turning you in a sideways position during surgery. That takes time. If you're doing the other side, then we are again going to turn you under anesthesia to the other side. That takes time. So when I say 4 to 6 hours, it doesn't mean that the surgery actually will be going on for 4 to 6 hours. The surgery may be just for 3 hours, but getting inside, going under anesthesia, putting you in a correct position, then doing the surgery, again changing your position a couple of times. All this takes a while. But having said that, it is a procedure under complete anesthesia for about 4 to 6 hours. This procedure involves a couple of technological advances which I refer. The incisions or the cuts made during this surgery are very small and generally about 5 to 6 millimeters. They will be placed in areas where they won't be noticeable later. So usually in your underwear line or in your armpit or somewhere inside in your belly button, something like that. Through these punctures, we inject fluid into your fat. So this fluid has some drugs in it which helps us to remove the fat easily. After this has been done, we use an ultrasound liposuction method through which we melt the fat under the skin. This procedure takes about 10 minutes to 15 minutes each area we are operating. So the fat is melted and mixed with the fluid, making it into an emulsion. This makes it very easy to remove during the next step. And the next step is power-assisted liposuction. So we use power-assisted devices which vibrate as we insert them into the fat and we suck out the emulsified fat. The combination of ultrasound and power-assisted liposuction works to a huge advantage because it reduces the bruising, it reduces the swelling, it reduces the amount of blood loss which can happen during this procedure, and it takes all the fat out in a very regulated manner. So in some procedures where there is a lumpy feeling left behind or there is extensive bruising or unevenness, which you may have heard of as problems happening after liposuction, these don't happen when a combination of technologies is used. So in my practice, I use ultrasound liposuction combined with a power liposuction to give you the best result. Since this is a relatively long procedure and your safety is paramount to us, we make sure that our operation theaters are equipped with warmers. Our anesthetists are ready to make sure that you don't feel a thing during the surgery and you wake up feeling comfortable. Since this is a relatively long procedure, I do prefer my patients stay overnight so that we can monitor them, take care of their pain, and send them home in the safest way possible. After liposuction procedure, it is common to have a little bit of fluid leakage from the puncture points. And this is good because we don't want the fluid staying inside. It's better it comes out and gets discarded. Whatever excess fluid may remain under your skin as in the form of swelling will be absorbed by your body and will be passed out in your urine. The rest of the fluid will be absorbed by your body with the help of the compression garment. So here the compression garment is going to be your best friend for at least 3 to 4 months. It is very important to wear a properly fitted compression garment. Make sure it is tightened periodically and to make sure that you wear the garment for at least 20 to 21 hours every day. Initially, for 2 to 3 days, I ask my patients to wear it for about 12 to 14 hours and take breaks in between till they get used to the feeling of tightness. But after 3 to 4 days, once your skin has had a chance to recuperate, the garment will be on for a long time. Trust me, the garments which we provide do shrink by one size each in about 10 days. So I have had patients who have gone from an XL to a large to a medium in the span of a month. These exceptional changes in the torso are possible only with the combination of technologies and with the proper selection of the patient. So large volume torso liposuction will be suitable for you if you have a lot of fat and some amount of extra skin around your torso, but not for skin with a lot of stretch marks, because then you're predisposed to developing loose skin after the procedure. Ultrasound liposuction helps in tightening the skin as well, which is also compounded by the use of pressure garment. So all these things go hand in hand in achieving the perfect shape to your torso. In your recovery and follow-up period, though the incisions are not big, I will need to see you at least 1 or 2 times to make sure that the cuts have healed well. I will also need to monitor that there is no fluid collection anywhere and your bruising, little bit which may happen, is resolving as it should. Overall, the post-op follow-up is not prolonged, but I will need to see you maybe once in a month to make sure that the garment you're wearing is tight and it doesn't need any further alteration. To summarize, recovery from a large volume torso liposuction is not too bad, but you have to be disciplined with the garment and you have to make sure that you get the garment tightened as regularly as required. So I hope this detailed video helps you in making the right decision. Thank you for watching and do share and subscribe.